live on Facebook. I'd like to turn things over to Dr. Levine.
Good afternoon. I'm Dr. Rachel Levine. I'm still the Secretary of the Pennsylvania Department of Health. Today, we received our weekly report from the White House Coronavirus Task Force. That report says, quote unquote, there is now aggressive, unrelenting, expanding, broad community spread across the country, reaching most counties, without evidence of improvement, but rather further deterioration. Current mitigation efforts are inadequate and must be increased to flatten the curve to sustain the health system for both COVID and non-COVID emergencies. Quote unquote, from today's White House Task Force Coronavirus Report to Pennsylvania. As you know, in Pennsylvania, we continue to see the number of new COVID-19 cases rising, our percent positivity rising, our hospitalizations rising, as well as the number of Pennsylvanians critically ill due to COVID-19 in intensive care units rising. In order to help stop the spread of COVID-19 in Pennsylvania, we are taking targeted and strategic actions. First, modeling available from the Institute of Health Metrics and Evaluation, the IHME model, from the University of Washington projects that Pennsylvania will run out of intensive care beds in December. These models suggest that there will be sufficient med-surg beds or medical surgical beds across the Commonwealth, but it is not clear that they will be available in all regions. And these models actually do not take into account people who may be hospitalized due to influenza. To address this, I have outlined my expectations for acute care hospitals and their chief medical officers, outlining our opportunity to work collaboratively during these challenging times. Our healthcare facilities have a great tradition of mutual aid and support to ensure that every patient gets the treatment that they need. And so, the hospitals and health systems and their chief executive officers need to be working now through our healthcare coalitions and other partnerships to review and prepare now how they will support one another should we get to the point that a hospital could become overwhelmed. Hospitals should also be working now to move up elective procedures and prepare to reduce them if our healthcare system becomes strained. It is my expectation that hospital leaders will use clinical judgment, of course, to determine what procedures can wait without adversely impacting a patient's health. The governor and I are truly grateful to the hospitals and really all of the very brave, courageous healthcare providers who have been on the front lines of this pandemic and actually lost many of their own due to this virus. It is my sincere hope that through continued perseverance, teamwork, and ingenuity, our healthcare professionals will collectively provide Pennsylvanians with the necessary and high-quality care that they have always provided and that our population deserves. Next, I have issued an order requiring anyone who visits Pennsylvania from another state to get tested within 72 hours before entering the state. They need a negative test within 72 hours before entering the state. If you do not have your test results when you come to Pennsylvania, then you need to quarantine until you get a negative test result. If you can't get a test, are waiting for your results, or choose not to get a test, you must quarantine for 14 days once you arrive into our state. Pennsylvanians who have traveled to other states must follow the same rules when they come home. Now, this does not apply to people who commute to and from another state for work or for medical treatment. For example, if you live in Wilmington, Delaware, and work in Pennsylvania, you do not have to have a daily test and you do not have to quarantine. But we do recommend that you telework when possible. And we strongly recommend that you download the COVID Alert app so that you can be notified if you are exposed to another user in Pennsylvania or Delaware that tests positive. This order takes effect on Friday, November 20th. Today, I have also strengthened the masking order that I first issued on April 15th. Wearing a mask is really one of the simplest steps that we all can take to slow the spread of COVID-19. It is critical. We wear masks whenever we are around other people to protect ourselves and protect those we love. In this order, masks are still required to be worn indoors and outdoors. When indoors, masks will now be required anytime you are with people outside of your household, even if you are socially distant, more than 6 feet apart. This applies to every indoor facility, such as schools, gyms, doctor's offices, public transportation, anywhere food is prepared, packaged, or served. And this applies if you have people in your home who are not part of your household. As you have heard from health experts around the country and the world, as well as myself, masks are a simple yet very effective way to limit your exposure to COVID-19 and limit possibly exposing somebody else. Recent data from the CDC indicates that actually it protects you in addition to protecting somebody else. So you're both protected. We must all be diligent in wearing masks all the time. And finally today, the Department of Health and the Department of Education have issued recommendations for colleges and universities that they need to develop and implement a testing strategy to prevent outbreaks among students, particularly when they return to campus from the upcoming holiday break. These strategies include establishing routine protocols for testing and reporting, including testing all students at the beginning of each term, when returning to campus after a break, and have regular screening testing throughout the term. Colleges and universities should also have adequate capacity for isolation and quarantine, and should be prepared to enforce violations of their policies, such as social distancing policies and mask wearing policies. As you have heard me say almost daily, this virus has certainly taught us that we are all interconnected, and it is our collective responsibility to protect our communities and our most vulnerable Pennsylvanians from COVID-19. This has not changed. These strategic and targeted actions are an important start to protecting our communities. Each and every one of us has an important job to do to make sure that schools and businesses can stay open. And importantly, our healthcare system can treat us if we are sick, whether that's from COVID-19 or another illness. We must stand united in stopping COVID-19. We must wear a mask, wash our hands, social distance, stay apart, download the COVID Alert mobile app. We must answer the call and collectively do our part. And as always, stay calm, stay alert, and stay safe. And now I'm pleased to take your questions, and April will work the questions.
Thank you. So you will get a request to unmute yourself. When you have a question, when it's time your turn to ask a question, you'll be able to ask a question and a follow-up. We'll try to get as many in as we possibly can. First question is Sheldon Ingram. Sheldon, you are unmuted.
Good afternoon. Thank you for taking my question. My question to you, Dr. Levine, is it the intention of the state to enforce restrictions after the holiday season to not further dampen the mood of the general public? When I say further restrictions, I'm speaking of the colored phases, such as red, yellow, and green. Is it the intention of the state to enforce these restrictions as the numbers increase after the holidays?
We have no plans to go back to the red, yellow, green schema.
Secondly, how do you intend to enforce the mandatory mask wearing process, such as in gyms, and other facilities where the public gathers.
It really is the responsibility of businesses to enforce the universal masking orders. Now, we don't want businesses and as they enforce those to lead to conflict or anything like that. But I mean, it will be the responsibility of law enforcement and businesses to enforce those mandates when people are in those businesses. And we really expect that and anticipate that the public will come together and we will stand united to be able to stop the spread of COVID-19 and the significant increases that we are seeing as outlined by the federal government.
Next up is Justin Schweitzer. Justin, you have been unmuted.
Hi, Secretary. Thanks so much for doing this. You painted a pretty dire picture when reading the White House Coronavirus Task Force excerpt at the beginning of the call. And just given how bleak that seemed at times, do these targeted measures in your eyes go far enough to address the massive surge that we're seeing that's even larger than what we saw in March and April?
Mm-hmm. I think that these targeted measures are extremely important, and we want to emphasize all of these very important measures. Whether we have to do anything else really depends upon you. It depends upon the public. It depends upon the news media in terms of how this is rolled out, and it depends upon the public. Each one of us taking our responsibility for the common good of everyone in Pennsylvania. And if we all do our part and we stand united, then we might not need any further mitigation measures taken. If people do not follow these measures and our numbers increase as they have been indicated by the IHME model, then I can't predict the future and what will be necessary. So I think it really comes down to each and every one of us and what we choose to do. What we are asking everyone is to stand united to stop the spread in Pennsylvania.
Okay. Next up is Liz Kilmer. Liz, you have been unmuted.
Dr. Levine, thank you so much for your time. I'm wondering if you can just speak a little bit more specifically about enforcement. For instance, with the testing, if someone gets off of a plane from another state landing in Pennsylvania, can they expect follow-up? Another example, hospitals, universities, if they don't follow these recommendations, could they be cited? Just if you could talk a little bit more about how this will be enforced.
Sure. So we have no plans at this time to be enforcing, checking for tests as people come off airplanes, or certainly, as people drive into Pennsylvania. These measures are actually, in terms of traveling, are extremely similar to what other states are doing as well. Well, I think what we're all asking in all of our states is actually for people not to travel. We really want people to stay at home and to stay within their household and not to travel. For example, to do a lot of traveling to see friends and family during the Thanksgiving holiday. But if people are going to travel into our state, we want them to have a negative test within 72 hours. In terms of the universities and the colleges, I mean, we have had extensive discussions, and the Pennsylvania Department of Education has had extensive discussions with colleges and universities. And this isn't all brand new. We've been discussing this, but we wanted to outline specifically what we expect from colleges and universities. We also have had extensive discussions with hospitals and health systems and the Hospital Association and the hospital coalitions. And so this is just outlining our expectations and really empowering them to collaborate and to take control and to be prepared for the surges that we see that are coming.
So is it fair to say that really these measures are more expectations than requirements being placed on people?
No, there are requirements that are being, in terms of, for instance, the masking order. That is a requirement. That is an order from the Secretary of Health.
Next up is Flora Pastorera. Flora, you have been unmuted.
Secretary, you've talked extensively about, at this point, there are no plans to shut down the state as we had done back in the spring. What has to happen for that to occur? How bad do things have to get? You did quote that White House report, and things do sound very dire. At what point would you, in fact, shut down the state as occurred back in the spring?
It's impossible for me to predict the future in terms of exactly what conditions might exist. I read that report because if you look at the data that is put out by the White House Task Force, and you can see the same data when you go to the Johns Hopkins website, or even if you go to CNN and the New York Times website, is that COVID-19 is burning throughout our country. The Midwest and the Mountain West are most impacted, but every single state in the country, from Maine to Hawaii, is being impacted by COVID-19. And so what we are saying is that, Pennsylvania is not an island, and Hawaii is an island, and they're going up as well. And, we're seeing the impact of those increases throughout the country. And so we all need to stand united and to do these simple things. We want people really not to travel, but if they travel, when they come back in, they need a negative test. We absolutely are ordering people to wear masks in really all settings. And we need people to social distance. We need the colleges and universities to take responsibility for their students in terms of testing and isolation and quarantine. And we need the healthcare system be prepared. So that is the summation of what we're talking about today.
You did talk about the college students and you did quote that White House report. So is it time now for local schools and local school districts to pull the plug and just go virtual in Pennsylvania?
Well, we have very specific guidance for K through 12 schools in terms of whether they should be having classes in the classroom, whether they should have maybe a hybrid model, or if they should be in virtual mode. And so, we work with those school systems in terms of that decision, and we ask them to follow that model.
Next up is Deanna Durante. Deanna, you have been unmuted.
Thank you. We've been hearing for months when we would ask you about how you're going to enforce these orders, different orders for different counties. Now, everybody, when you come into Pennsylvania or you leave Pennsylvania, you come back to Pennsylvania, you have to get tested. And multiple times you had said you trust Pennsylvanians to do the right thing. But if the case counts are going up, doesn't that mean you can't trust people on the honor system? And you can order people to get a test when they leave the state or come back, but it doesn't necessarily mean they're going to do it.
Well, again, how Pennsylvania does in terms of this pandemic, and whether we follow the IHME model's projections or whether we don't, is actually going to come down to the actions of every single Pennsylvanian. And that is why I keep mentioning the collective responsibility. We all are blessed to have freedoms in our country, but with freedom comes responsibility. That's not a new concept. That's been articulated since the beginning of our country. And we all have a responsibility to work towards the common good. And right now, that means following these orders and guidance in terms of stopping the spread of COVID-19 in Pennsylvania. So in the end, it will come down to the actions of each and every one of us and whether we do that.
A common complaint that has been said throughout school districts and other organizations, municipalities, is lack of a cohesive plan. You're now saying it's up to the municipalities and the counties and the restaurant and the gym owners to enforce these rules, where it was just also up to the school districts to come up with their COVID plans, only to have the rug pulled out from under them towards August. So where is the cohesion in all of this and the working together? Because that is a chief complaint we're hearing, at least in the southeast corner of the state.
Well, I think that we actually have a very coherent plan, and we still have mitigation orders in place in terms of in terms of restaurant capacity indoors, and then in terms of gatherings. There are three ways to deal with a pandemic. You can work to contain it through testing and contact tracing, isolation and quarantine. You can work to mitigate its spread, which is what we're doing now. And then we will have, it looks very promising about the development of a vaccine, but that's not going to happen overnight. And it's going to take a significant amount of time to be able to distribute and administer the vaccine, most of whom have 2 doses. So again, we all need to work together on containment, mitigation, and then the vaccine. Those are the tools in the toolbox in order to stop the spread.
Next up is George Solis. George, you have been unmuted.
Thank you, Dr. Levine. Just a question, kind of, again, reiterating on the travel guidelines. So what happens if someone, an airline or a state trooper, someone pulls over someone and says, have you been tested, and nothing comes of it? They don't want to test it. They don't have proof of it. Are we talking citations? Are we talking a reprimand? What further push could there be to ensure that someone either quarantines for the appropriate time or does in fact get a test?
Well, I mean, I actually do have the authority as Secretary of Health to enforce isolation and quarantines. We're not looking to take people to court to be able to do that, but I do have that authority. And so, you know, we cannot check every car driving into Pennsylvania, and we have no plans to check everybody coming off every airplane in Pennsylvania. And so, really, in order for everyone to work together, as other states are requiring these same measures, they have the same challenges in terms of enforcement as well. So it's not just in Pennsylvania. So we are stating what our orders are, and we want to communicate that we expect that people will comply.
With testing, especially around the holidays right now, we are hearing, at least here in our part of the state, so many people saying that they are waiting longer now for testing because they are trying to plan and coordinate for the holiday travel. Clearly, this is not the guidance of the state to say, get a preemptive test, especially when a result today may not be good tomorrow. So what is the guidance, and are there constraints on testing now as we move forward, as we get closer and closer to the holiday and as cases surge in the state?
Sure. So you need a test within 72 hours in order to come back into the state. Other states have been even more strict in terms of 24 to 48 hours. We gave a little leeway in terms of 72 hours. And we do have significant testing capacity throughout the state. We just got an email from Quest that some of their labs are taking 24 to 48 hours to test results. Occasionally it might be longer, but we're not to the point where it was a week or more. And so there is capacity to do that. But actually, we don't want people to travel. And other states are saying exactly the same thing. We don't want people to be traveling to our state for the holidays. We don't want Pennsylvanians to be traveling for other states for the holidays. We want people to stay at home within their household and to visit with their loved ones and neighbors and friends in this state and other states remotely. I understand that that's a tremendous sacrifice for Pennsylvanians and really throughout the United States to make. But this is the biggest public health crisis that we have seen in 102 years. We have had 9,355 deaths in Pennsylvania. If you look at the IHME model, it's anticipated we could have 12,000 deaths by January and 18,000 deaths by March. In order to stop the spread and not have those very serious numbers, then we all have to do our part. Again, containment, mitigation, and then distribution of the vaccine when it's available. Those are the tools in the toolbox.
Next up is Seth Kaplan. Seth, you've been unmuted.
Dr. Levine, I feel sometimes like we all sit here in this room and say this is all reasonable information. Of course, anybody should respond to that appropriately. And then when I travel to places like Mifflin and Juniata counties, the top two in terms of COVID per capita right now, I was in Mifflin yesterday. There's this disconnect. I think there's this skepticism, back to the question you answered yesterday about politics. And what I'm wondering is, given the fact that sometimes the messenger is just as important as the message, what the state is doing to ensure that local officials, for example, who believe many of the same things that you're saying, but who maybe have more credibility with some of these people, that those messages are being delivered in those communities as well as in other communities where people might trust different leaders alongside what you're doing.
Sure. So a couple of things. One, as you pointed out, COVID-19 is not just an urban issue at all. And throughout Pennsylvania and throughout the nation, we are seeing rural communities significantly impacted by the spread of COVID-19 with community transmission. So actually, we have reached out to stakeholders throughout the state yesterday and today about these orders. I spoke directly with the legislature yesterday and legislative leaders of both parties, and we have reached out to the county commissioners and all of our county and municipal health department partners today about messages. And you are entirely correct. This cannot just come from me. And this cannot just come from the governor. This needs to come from all local officials and other local public health officials, from hospitals and from health systems. This message has to come out in a coordinated, unified way so that the public can understand how this impacts them and then be able to work to stand together and stand united against COVID-19.
Thank you.
Okay, next up will be Wallace Mckelvey. Wallace, your request to be unmuted has been processed.
Thank you, Secretary. I wanted to have you elaborate a little bit on the hospitalization issue for me, because as you probably know, hospitalizations are a lagging indicator, and looking at the curve right now, it's been on an exponential rise for the last few weeks. I know you keep saying you can't predict the future, but I think you probably can a little bit based on past experience here. What should the public know about hospital capacity right now? And
Sure.
do you anticipate, for example, pausing all elective surgeries, operations at some point in the next few weeks?
So, I mean, within our hospital and health systems throughout the state are doing well. They're able to take care of the COVID-19 patients. They're able to take care of non-COVID-19 patients. And we have been in discussion with hospitals and health systems, and we know this is really a memorandum that I have written to really all the hospitals, just to emphasize the critical nature of us all cooperating and collaborating and working together. Because I think you're correct that we are going to see increases in terms of the hospitalizations and the ICUs. Our medical care is much better. And so we're hoping that that we don't see some of the numbers that we saw in the spring in terms of deaths. We have better intensive care, better use of and more judicious use of ventilators, and then we have treatments such as remdesivir and dexamethasone, and now the new monoclonal antibodies. But we will see challenges. We do anticipate seeing challenges to our healthcare system. We want everyone to work together, and if we all work together to be able to withstand the surge, then we won't have to. From the state's point of view, do anything that's widespread, like canceling electives. Will some hospitals have to moderate their elective procedures in order to conserve beds? They might, and they are in best position to do that. And as I called upon them, I mean, the CEOs and the medical personnel are in the best position to decide which procedure needs to be done now, which procedure could be done a little earlier, so that it's accomplished, which could wait. So we don't want to take that measure from the state like we did in the spring. We want them to and want to empower them to do it. If there is a critical aspect, then from a regional basis, I might have to act. But what we're hoping is that we don't have to do that from the Department of Health and from the state, is that they are self-policing themselves.
Wallace, any follow-up?
I mean, it seems like the general philosophy right now does seem to be self-policing, but are there limits to that? Given what we see out in the world, a lot of people just aren't wearing masks.
That is exactly, I mean, I think that you'll find that the majority of Pennsylvanians are wearing a mask, but there is a sometimes vocal minority that are not. And that's exactly why we are reissuing and making even more stringent our order.
Next up is Erin McCarthy from Philadelphia Inquirer. Go ahead, Erin.
Hi, Dr. Levine. Thank you so much again for taking the time to do this today. When you talk about schools reopening, you often refer back to the Commonwealth's guidelines, which say that schools and counties with substantial community spread should be operating virtually. Yet many schools in counties with those types of levels of transmission are continuing to teach students in person. I know you say that local authorities should make the call on whether to close schools, but what's the rationale for the recommendations if they aren't being followed?
Well, I think that it is challenging if they're not being followed. Now, there might be local conditions in their area that, from a public health perspective, that is driving that decision. But we're going to be watching this really closely. We're going to be watching what the schools are doing. We're going to be watching our numbers really closely. And we might come with further contingency plans. But right now, we are sticking with our previous recommendations to school districts, to school boards and superintendents.
Next up is Jim Mower. Jim, you are muted.
Hi. If there's no enforcement here, and you've been saying all along that you're relying on people to do the right thing, but there's a contingent of people who make it very clear they're not going to follow the rules, they're not going to wear masks, they're not going to do these things. Without enforcement, isn't this just effectively empty rhetoric?
Absolutely not. I reject that completely. I don't think this is empty rhetoric. I think that this is talking to the people in Pennsylvania about the conditions that we are seeing on the ground and the public health measures that are absolutely necessary to protect the public health. In the end, people will have the consequences of their actions as well as their families and their communities. And if they do not wear masks, if they do not social distance, then those communities are going to see even more spread of COVID-19. What we want to do is outline what the tools that are in our toolbox, the tools that we can convey to the public, and then continue to work with the public on why we're recommending and ordering what we're doing, and continue to articulate that message. Thank you.
So you say no return to red, yellow, green, but is there a possible revisiting of restaurant limitations, gyms, salons, any of those things?
Well, we already have restaurant limitations. We have restaurant limitations to 50%, except for outdoor. Outdoor is a little more challenging now because the weather has finally turned. That's the concern. The weather has turned. It's getting colder. As it gets colder, it drives people indoors. As it drives people indoors, you have more spread of a respiratory virus like COVID-19. That is why the Mountain West and the Upper Midwest have been so impacted. They were colder first. And if you look at the numbers that are easily available in those areas, it's serious here. It is absolutely burning there, and their hospital systems are challenged. We don't want to look in a month like Wisconsin looks now, which is why we're taking these measures now, and we might take other measures in the future if we have to. But these are the measures that we are taking now to stop the spread.
Next up is Ron Southwick. Ron, you have been unmuted.
Hi, good afternoon, Secretary. Just wanted to, again, follow up on a question you've been asked a lot, but just in terms of hospitalizations, you said overall the state hospital systems seem to be hanging in. Are there specific regions where hospitals are getting more challenged?
There are some regions where hospitals are more challenged at the moment. In the Northeast, they're somewhat more challenged. Philadelphia, it had the biggest increase in the spring and can be somewhat challenged. But we're not. There is no place in Pennsylvania where we're in danger of running out of hospital beds, ICU beds, or any staffing or PPE. We don't want to get to that point, which is why I'm sending my memorandum and articulating that today.
Just to follow up, are you seeing any reported rise in infections among healthcare workers, either physicians or nurses? Are you seeing any uptick in the healthcare workers in the hospital systems?
We have seen a steady, slow increase in terms of healthcare workers throughout the pandemic. We have seen no exponential rise in healthcare workers. I think that there is adequate personal protective equipment. Healthcare workers have a lot of experience with this virus now and are able to take precautions. We always see, it is tremendously brave and courageous for people to still be working on the front line in hospitals, in doctors' offices, in clinics, in nursing homes, and other long-term care living facilities. Overall, we see increases, but we're not seeing any dramatic increases.
And our last question today is from John Finnerty. John, you have been unmuted.
Hey, Secretary. Hope you can hear me. One of the things I hope you can address is there seems to be a lot of angst, especially among like the high school sports community, about whether or not there's going to be a shutdown on championships or winter sports? Are you leaving that to PIAA, or is there anything in the works that you can address that?
Nothing that we're announcing now. Again, we are continuing to look at data, of course, every day. We're continuing to see increases. We will take whatever measures are necessary to protect the public health, but we're not announcing any change on that today.
John, you've been unmuted for your follow-up. Okay. All right. Thank you so much.
Thank you all.
That concludes our briefing for today. Again, a video recording will be